In relation to National Cabinet, whilst obviously that I wasn't there, the briefing I've had is very clear that the focus of that is to make sure that we're keeping Australia safe at a time of an expanded global pandemic. The figures we know are reaching extraordinary levels. And so we have put the pause on the flights from India, but in particular the Prime Minister and National Cabinet were focused on making sure that we have a pathway for repatriation flights from India to begin as soon as possible after the 15th of May, once we've seen a reduction in the number of cases in Howard Springs, and the same is the case with regards to commercial flights. Those final decisions will be taken by the National Cabinet, but what we're seeing is lifting of the pressure within both the hotel quarantine and within the Howard Springs facility, and that is opening up the possibility for that resumption exactly as discussed, as early as possible, subject to the final National Cabinet decision. In relation to the health ministers, the central point that came out, and we were fortunate to be briefed by all of the chief health officers who were present. It's the first time since the pandemic that we've had everybody together in person, health ministers and chief health officers. And the point that came out, as well as the briefing from the co-chair of the Australian Technical Advisory Group on Immunisation, Professor Alan Cheng, and from the head of the TGA, John Skerritt, was a strong, united commitment to reaffirm the importance of the safety of the vaccines and the importance of being vaccinated, just as they've done here at Star Health with over 5,500 vaccinations. A unanimous view across all of the ministers, all of the chief health officers and the TGA about the safety and the fundamental importance of coming forwards to be vaccinated to protect you and protect everyone else in your community. Finally, just in terms of the update, no new cases today within Australia. At the same time, 882,000 cases and 14,500 lives lost around the world. 0 cases in Australia, over 882,000 cases and 14,500 lives lost around the world. It just reminds us of the fortunate position we're in through the work of Australians and the work of our health professionals. Finally, in relation to vaccinations, what we've seen is another 67,000 vaccinations in the last 24 hours. We're now at over 2,175,000 vaccinations, and in particular, we've seen our primary care network deliver over 1.15 million vaccinations, including over 42,000 in the last 24 hours, 1,625 aged care facilities with first doses, over 1,000 aged care facilities with second doses, and so that program is protecting our most frail and most vulnerable Australians. Today, though, we're focused on our youngest Australians who are suffering from a deeply debilitating condition in Dravet syndrome and access to new medicines.